I chose my capstone project to go to Nepal because I grew up there and I was 19 years old when I first moved to the United States. Apart from that, there was a big earthquake that happened in Nepal, April 26, 2015. My family experienced it, my neighbors, and a lot of other people who lived there. And a lot of people lost their lives. And then it dawned in my mind that if I was there, I would be scared. I think it would have probably left a mark in my mind or in my heart. And I wanted to understand that suffering with adolescents in Nepal.
Srijan has been in our capstone in Global Public and Community Health for his first year, and he came to me with this idea of going to Nepal and working with children there to see the effects of their devastating earthquake head on their psychosocial wellness.
I randomly selected 2 schools in Kathmandu and then 2 schools in Sindapalchok, which is the big epicenter of the earthquake. I also wanted to check the differences between the public and private school, if people who are from low socioeconomic status may suffer through the psychological distress more or less compared to people who are well off. This study is gonna show a psychological study in Nepal, which is very rare.
In Srijan, you see a very honest, very caring individual who really wants to make a difference for his patients and for his community. He went back to Nepal because he wanted to make a difference. He wanted to understand the challenges. He grew up there. He understands what it was like to be a small child with challenging circumstances. And if you add on that the loss of family members or the loss of your school or the loss of your livelihood, he wanted to understand that better.
Doing this capstone project is very, very essential for medical school education. I think it has given me the perspective of a researcher. I think it helped me understand the global perspective of medicine. And most importantly, this study has given me motivation to study even more because there are still people who are suffering and people who don't have medical care. And I think going over there in Nepal has given me even more motivation to actually go into medicine.